It has been more than a year since the COVID-19 pandemic began. The governments of each country have deployed all kinds of things so that their people are protected from the virus. However, over time it turned out that the physical is not the only things need to be considered in this day and age. So, what is as important as physical health? I am Annida Fitri inviting you to discuss about mental health issues during this pandemic. Mental or psychiatric health problems are one of the detrimental effects of COVID-19 pandemic. According to World Health Organizations in 2020, the average use of a pandemic causes stress at various levels of society. People who have the most potential to experience mental health disorders from COVID-19 are those who have previously been at high risk if they experience isolation. According to research from Johns Hopkins University in the United States, people who before the pandemic already had a limited social circle were more prone to psychological problems because the number of friends or family who can be invited to communicate during a pandemic is more limited. Loneliness and social isolation also increase the risk of depression and anxiety disorder in children and adolescents. While schools are still conducting distance learning, children and adolescents should receive more attention regarding their mental conditions. Teenagers and young adults aged about 18 to 24 years old are known to feel a lot lonely during time of social distancing, even though that age is time for them to develop their identity through the friendship environment. The mental health risk of COVID-19 in adults and the elderly tends to be smaller because there is less need to socialize. However, based on the several studies, there are a number of factors that can increase the risk, including first, family gender, because it is more susceptible to stress and post-traumatic stress disorder. Second, are of productive age and receive a lot of information from social media or mass media which can add pressure. Third, higher educations because they are more aware of the importance of health, so they are so more susceptible to stress because they think too much about health threats. Fourth, you still have to work during this pandemic because you are more worried about contracting COVID-19, especially when using public transportations. 5. Decreased income or job loss due to pandemic. And last, live in an area with a high transmission rate or many acquaintances or family members who are positive for COVID-19. People who have confirmed COVID-19 will experience feelings and or symptoms such as regret and hatred, discomfort, loneliness and helplessness, depression, anxiety, phobias, resentment, and lack of sleep. To maintain mental and psychosocial health during the COVID-19 pandemic, there are several tips that you can be practiced by the community according to the recommendations of the Associations of Indonesian Mental Medicine Specialists, including first, reducing anxiety by limiting excessive information related to COVID-19 information that is not yet known. Second, selecting the information obtained. The community as much as possible gets accurate information from trusted sources and takes the recommended prevention or treatment. Third, avoiding uncomfortable feelings by doing positive things such as avoiding smoking, consuming alcohol and drugs. Fourth, people can also perform skill techniques such as deep breathing relaxations. 5. If you feel stressed or uncomfortable, immediately consult a mental health professional such as a psychiatrist or counselor to get quick help. So, all tips above show that mental and psychosocial health is important as physical health and needs to be considered by all parties. I'm Annida Fitri. Thank you for watching. Stay healthy and have a great day.